I want to talk to you about something that's about to hit millions of American families. If Congress doesn't act soon, the Affordable Care Act tax credits are going to expire at the end of this year. The reason this is so important right now is because re-enrollment begins on November 1st, and without the tax credits, 22 million people will start getting notified that their healthcare premiums are going up by an average of $700 a year. For some families, those hikes could be thousands of dollars. And this couldn't come at a worse time. Costs are already up on everything: groceries, utilities, medications, and families are stretched more than ever. To make matters worse, Donald Trump just signed into law his one big ugly bill, which is cutting $1 trillion from Americans' health care and ripping coverage from 14 million people, all to fund tax cuts that will overwhelmingly benefit the wealthiest 1%. We cannot let this happen again. But here's the thing. Republicans control the entire federal government. They have the House, the Senate, and Donald Trump is in the White House. And if Republicans don't act, millions of Americans will lose coverage, and millions more will face skyrocketing premiums. That's unacceptable. Democrats are ready to act to protect your health care, but we need Republicans to work with us now to stop yet another giant price hike from happening on their watch.
It is day 6 of the government shutdown, and Republicans are still refusing to negotiate with Democrats to lower healthcare costs for millions of Americans. At the end of this year, the Affordable Care Act tax credits are set to expire, and these tax credits, they lower the cost of health insurance for millions of Americans. Republicans want to pass their bill that would fund the government at its current levels and bump the conversation of next year's budget and extending these tax credits until November 21st. But that is too late because open enrollment for the Affordable Care Act marketplace, where people buy their insurance, starts on November 1st. The cost of health insurance will drastically increase if insurers believe that these tax credits are going to expire. Healthcare is already too expensive, and Republicans are willing to make it even more unaffordable.
Shut it down. If you're going to share any post, let it be this one. Because the Orange King canceled the meeting between Hakeem Jeffries and Chuck Schumer to negotiate to keep the government open. They need Democrat votes to do so. And the Democrats said, well, we'd like people in this country to have health care. And we're not just talking about people who are on the ACA, who are going to see their premiums go up between 75 and 95%. But we're talking about millions of people who are cut out of Medicare, millions of people who will have the price of being on Medicare unreachable because their copays are going to go up, their prescription prices are going to go up, but also people who are on their private insurance. Those premiums are going to go up as well. And the Democrats are saying, if you want to keep your government open, you need to crawl back some of those cuts so that people aren't left with no health care. And instead of saying, yes, let's sit down at the table and work something out, the big negotiator that he is just closing the door and saying, we're not going to do anything. We don't even want to talk to you. So when the government shuts down, and I hope it does, this will fall on the fault of the Republicans. They have the House and the Senate and the presidency. They should be making a deal. And the Democrats should not fold. We should not be funding a government that doesn't work for us and is causing harm and fear and torture in this country. So that's my thoughts. Shut it down.
Well, there it is. Today's Republican Party genuinely does not care whether or not you have health care. Watch.
Are you in favor of extending the COVID Obama subsidy or the subsidies for Obamacare?
I'm not. You look at this was always meant to be a temporary emergency COVID era subsidy. It's a $350 billion price tag, and it is absolutely rife with fraud, waste, and abuse. And
oh, look at that. Suddenly, Republicans are worried about the cost. $350 billion. Know how much Trump's tax cuts in the One Big Beautiful Bill Act, the ones that go almost completely to the richest people in America, you know how much those are going to cost us over the next 10 years? $4.5 trillion. Trillion with a T. Now you may say, wait a minute, why wasn't I aware that it was going to add all that much money to the deficit? Well, because Republicans used an accounting trick when they were extending the rich people tax cuts. They used something called the current policy baseline to make it look like the tax cuts cost nothing, because they knew they had to get them through, but that Americans would be pissed if they knew how much they cost. Sadly, they have no such urgency when it comes to lowering middle-class Americans' healthcare costs. They don't want to use that accounting trick. They want to highlight the cost this time. By the way, a fun fact factoid that you should know: more than 90% of the people on the ACA make less than $63,000 a year. Exactly the kinds of people the Republicans have no interest in helping, but they are interested in, let's see, bailing out Argentina for $20 billion, sending U.S. military into cities even though they're not wanted or needed, upgrading a Qatari jet for Trump, that's going to cost $1 billion, and wow, let's not even get into how much Pete Hegseth's little man stunt with the military cost us. As for the so-called waste, fraud, and abuse, we know that that's just a phrase Republicans break out when they want to cut things that help Americans. Oh, and by the way, there is no actual evidence of rampant fraud in the ACA. Just FYI. Not to mention, if Republicans really cared about that, why are they letting all the rich tax cheats get off? Because they think rich people should get to keep all of their money. They just don't want you to have it. These premium increase letters are going to go out in the next few days, you guys. If you are on the Affordable Care Act, brace yourself. Because of the Republican Party, who own this shutdown, who own this tanking economy, and who own the healthcare crisis that we are in right now, you are going to see your premiums skyrocket. When you open that letter and you see that number, make sure that you have got your Republican lawmaker's phone number close to hand, and then you give them hell.
Democrats in Congress, I'm talking to you. Hold the damn line. Don't you dare fold like cheap lawn chairs at a cookout. Let's be clear. Republicans have the House. Republicans have the Senate. Republicans have the White House. This government shutdown belongs to Republicans. Don't let them bully you into signing their wish lists of cruelty, stripping health care, cutting vital services, and leaving communities to starve. Government is supposed to work for the people. See, some of you have only been trained that it only works for the rich. So when government actually pauses to say, no, we're not going to rob grandma of her insulin today, suddenly folks want to act like that's un-American. What's un-American is worshiping billionaires like they care about you, thinking their sparkle going to trickle down to your wallet. It won't. The glitter is fool's gold, and you're left sweeping up the crumbs. So Democrats, keep that backbone stiff. You understand me? You better hold the line like it's Black Friday at Walmart and there's only one TV left. Hold it like your mama held that phone cord when she was calling and telling your auntie all your business. Don't let go. And Americans, I need you to understand this. Trump is going to fire government workers no matter what, okay? Because the Supreme Court gave him the infinity gauntlet to snap and wipe out anything he wants. Republican Congress will not check him, which means that Democrats are the last firewall standing between you and that incinerator that's coming. So keep the government shut down if you got to. Do it by any means necessary. Better a locked door than opening it to thieves who are only coming to rob you. Because this fight ain't about politics, y'all. It's about survival. And survival means you don't negotiate with the school bully that's been stealing your lunch every day since the first day of school. You plant your feet, you grip tight, and you hold the damn line.
Well, it looks like this shutdown is really going to happen. And before we talk about the consequences, let's remember that Donald Trump controls every branch of the government, and it is his failure to come to the table and negotiate about our health care, the cost of our health care, that is causing this shutdown. Reminder, all of our health care is going to go up in the fall, and many, many people are going to lose all access. This is bad stuff. So how is it going to affect us in the short term? Well, starting tomorrow, organizations like FEMA will be hamstringed. So if there's a natural disaster, they're going to struggle to be able to respond appropriately. Vulnerable populations like moms and babies are going to have a hard time getting their WIC benefits and other things that they need in order to live healthy lives. And our active military, well, they have to work, but they don't get paid. So they're essentially stranded wherever they are. But don't forget, no matter what you hear people say, this is entirely in Donald Trump's hands. He has the power to stop it.
This video is for anyone who bought health insurance on the ACA marketplace. But if that does not describe you, please still stick around because our country is on the brink of a legitimate healthcare disaster, and I desperately need y'all's help. Here's what's going on. Unless Congress intervenes in the coming weeks, the cost of health insurance is set to go up by about 75% for millions of Americans come the new year. That is quite literally thousands of dollars more each month. Money that, frankly, most families do not have to spend right now. The reason for this massive cost increase is twofold. First, health insurance companies have asked regulators to allow an increase in premium rates, citing this guy's big, beautiful bill, as well as the impact that his tariffs are likely to have on the cost of things like medications and medical equipment. Second, and this is the really, really big one, the enhanced premium tax credits that helped make ACA coverage more affordable for most Americans are set to expire at the end of 2025, and Congress has yet to take action to extend them. And that is where you come in, and why I say I need your help. People enrolled in the ACA are about to start receiving letters in the mail from their health insurance company notifying them of how much the cost of their existing health insurance plan will go up in the new year. If you receive one of these letters, please take a photo of it and send it to me. I will not publicly share any letter sent to me, and you are welcome to redact every bit of personal information from that letter before sending it to me, as long as the dollar amount is still visible. When you send it, please share with me what impact this cost increase would have on you and your family. Things like, will you be able to afford it? If not, how is that going to impact you and your family? Are you going to have to cut other things out of your budget to make it happen, or is it just not possible? You can share as much or as little as you are comfortable sharing. My goal here is to help voters see the very real people, real lives, and very, very real devastation that will be caused here if Congress does not intervene. Again, nothing that you send to me will be shared publicly unless I have your explicit permission to share it. And please help me get this call out to as many people as possible by reposting this video and engaging with it in all of the ways possible. My videos are getting suppressed right now, as a lot of other content creators are also experiencing. So anything you can do to help me get this call out there to folks is so, so appreciated.
If Republicans don't come to the table, if we don't act, healthcare prices are just going to surge in every state across our country. In my home state of Massachusetts, 240,000 residents stand to lose healthcare coverage, including 65,000 due to the expiring ACA premium tax credits. Another 337,000 residents will just see their healthcare costs skyrocket without an extension of those credits, which is why this timing is so important. Everyone says, oh, we'll open up the government and then we'll negotiate. They don't end until, or they don't expire until the end of the year. But that is not dealing in reality, because we know that insurance companies are going to be mailing out their rates for next year. They're doing that now, today, October 1st, because re-enrollment starts on November 1st. And so without an extension, without predictability or certainty, we know what happens. Those premiums are going to go up.
What's at stake here? The Republicans have created a healthcare crisis. It was already a difficult situation, but by passing the big, beautiful betrayal of a bill, they basically are kicking 15 million people off of their health care, off of Medicaid. They are going to close down rural hospitals. Some of that already has happened, in part because of the $500 billion Medicare cut that was triggered because of their decision to increase the debt so much with tax cuts to the wealthy. Those are things that have happened. But the final thing is that when it comes to the Affordable Care Act, where you have 20 million people that are on these plans in each of their individual states, in my state it's called MNsure, they will not be able to afford their insurance. I heard this big time when I was out in rural Minnesota. I went to 13 counties last week. Time and time again, the farmers, over a quarter of them are on these plans, even higher in my state. And they told me, we can't afford it. It's going to double our premiums. One guy said it's like a perfect storm of ugly between the Republican tariffs and the health care costs and what's happening with their input costs like fertilizer because of the tariffs that have been put on those. That's what's happening right now. And what does the president do? $20 billion to Argentina, while our soybean farmers have literally had their entire market dry up. So what else has he done in response to our serious request to have negotiations? He posts a deepfake video with sombreros in it, and he thinks that's funny. This isn't funny to the American people who are starting to get their premium bills right now. Then today it's the Grim Reaper with himself in a video that is just, again, completely, he thinks this is funny. He thinks that people are going to joke about this. I promise you, they're not. They are seeing their premiums double right now. So why is this something we're standing up for now? Because it's happening now. Ask anyone you know. It is not a December thing. It is not a January thing. It is a now thing. And we are asking them to meet with us to do something to help fix this healthcare crisis. And it's something they can do. It's something I am sure many of you have heard them behind closed doors say they actually want to do, because they've realized so many of their rural constituents, and when you look at the number, you realize so many Republican constituents know that this is a plans that are relied on by small businesses, by individual farmers, by people that don't work at big corporations so they can't afford their own health care. That's what happens. And I just cannot believe that they've decided instead to repost offensive deepfake videos than actually get to work, open the government, and do something about health care.
We all have to get behind the Democrats calling for a shutdown. And Trump supporters, I am talking to you too. We need the Affordable Care Act subsidies to become permanent. And over 50 conservative groups are urging Trump to let them expire. And let me tell you, this is one example of the math. A couple who are 55 years old, collectively bringing in $85,000 a year, currently pay, on average, in healthcare premiums, $7,500 a year. If these Affordable Care Act subsidies expire, their premium, are you listening to me, Trump supporters? Their premium jumps to $24,000 a year. So while the billionaire class continues to become ungodly wealthy under this administration, private healthcare insurers and all of their executives are going to make a shit ton of money, because they'll get to charge you another $17,000 a year. Just a couple making $85,000 a year. A lot of us don't make that much. Who can afford to have 25% of their income go to healthcare premiums? We're just going to become uninsured. No one's going to be able to afford that. Are you ready for this, Trump supporters? Instead of owning the libs, can we not all get together and agree this is really, really, really bad, and it's okay to jump sides one issue at a time? Can you do that to save yourselves? Please.
Government shutdown, government shutdown, government shutdown. It's the Democrats' fault. They don't want to work with the Republicans. That is not what's happening here. If the Republicans do not work with Democrats, tax credits for health care are going to expire this year. The average person will see a 114% increase in their healthcare premiums starting next year. Let's put this into perspective. Under President Biden's administration, they said if you're a family of four and y'all have a household income of less than $128,000, you get a tax credit to help with your insurance, which meant that you couldn't spend more than 8.5% of everything you make for the year on your health premium. Republicans refuse to work with the Democratic Party in Congress right now to extend those tax credits. For example, a 6-year-old couple making only $85K, they would see an over $22,000 increase next year on average. MAGA owns this shutdown.
You can't scream it's about healthcare when you shut down the government to stop services to the very citizens who rely on it. Democrats are fighting for revisions that actually cut $50 billion from rural hospitals. These are the same hospitals that they claim women would suffer without. And while they point the finger at Republicans for not negotiating, there is nothing to negotiate. The continuing resolution is the exact same one they voted for 13 times before. There's nothing new. But this time, the Democrats loaded loaded it with $200 billion in healthcare provisions. Not for you, not for your family, but for non-citizens. That's Medicaid, Medicare, Obamacare, all funded by your tax dollars. And the part they don't want you to know is that they slipped in a loophole to the insurance companies so that they can bill Medicaid at higher rates for illegal immigrants than for American citizens. That scam alone is $28 billion, on top of $6 billion carved out for illegal immigrants with criminal records so that they could get healthcare too. So tell me, how does shutting down the government or dumping another $200 billion we don't have help a single American citizen? Oh yeah, it doesn't. I need to wake up and stop voting for these people who are voting against you.
Here is your daily reminder that the shutdown is happening because Republicans want to take away the ACA subsidies, which will mean everybody's health insurance will cost more. And the Democrats, what they want is an extension of those subsidies so that we keep everybody's premiums low. And Republicans are lying about saying Democrats want illegal immigrants to be on health care because they're not eligible anyways. It's a complete lie and they don't get it. Make sure you tell your friends and family this is what's happening.
Mike Johnson is being exposed because people in his own district are going to have their healthcare premiums raised by 300% because of this government shutdown. Keep in mind, he has one of the largest Medicaid populations in the entire United States, and he's trying to take that away from them.
One of the examples you've put out is in Speaker Mike Johnson's Louisiana district, a 60-year-old couple earning $82,000 a year. Their healthcare premiums will rise by almost $20,000, by 300% because of what their congressman is doing.
For a middle-class couple making $82,000, a $20,000 increase for their health care is a huge deal. We're talking groceries, mortgage payments, retirement savings gone. And that's all because their congressman, Mike Johnson, is playing political games. And the irony here is brutal. His district represents one of the largest Medicaid populations in the entire United States, so the people who voted for him voted directly against their own self-interest. And the worst part is this won't just affect people on Medicaid or Obamacare users. This will also impact people on Medicare, as well as those with private insurance. They will see their prices go up too. This is an across-the-board attack on affordable healthcare. Also, the Republicans can afford their massive multi-trillion-dollar tax cuts for the richest Americans. These shutdowns aren't abstract issues. They're not just about budget fights or political talking points. They have real-world consequences. When people can no longer afford to go see a doctor when they need to, they will undoubtedly lose their lives.
The government shutdown was just a couple of days ago, but yesterday, October 2nd, I got this letter talking about how my monthly premiums are going to go up for my health insurance. They obviously sent this out before the shutdown even took place in order for me to get it yesterday. So look at this. 2025 monthly payment is $218. They broke it down for me though. Thank you. Here's the math, bitch. Monthly premium of $627 minus $409 of financial help you get each month. That's the Affordable Care Act going away. So $627 is right now. Starting in January, it's going to be $727. So not only did they take away the $409, they increased this motherfucker by $100 a month. What the fuck?
They are absolutely correct, you guys. And right here is a little side-by-side comparison because, you know, MAGA, they love to look at charts and they need something, some sort of picture so that they can really understand things. So this is with the Affordable Cares Act. This is without the Affordable Cares Act. And this is what the Democratic Party was trying to stop before this whole government shutdown, because the Republican Party wants to remove the Affordable Cares Act. That's what they want to do. It's not about undocumented migrants getting health care. It is not about that. It is about the lower class and middle class citizens here in the United States of America that can afford health insurance, plain and simple. And here's the other thing, you guys. The job market, the economy, since Donald Trump has took office, it is the worst economy since peak COVID time. The worst economy. The job market, non-existent. Every single month when they end up releasing the jobs report, guess what? They're not adding new jobs. They're taking away jobs here in America. That is what they are doing. And for those that aren't from America, you guys have to understand this also. A simple hospital visit for someone, if they don't have health insurance, let's say they go to the hospital, they have to go to the emergency room and they're sick and they need urgent care right then and there. A simple visit can literally cost the American person thousands, if not tens of thousands, just going to the hospital. And I know you're thinking, well, just don't pay the bill. Well, here in America, guess what? If you have a job, they will garnish your wages. So now you're making even less money on your paycheck because you ended up having an emergency visit to the hospital. Also, here in America, if you don't have health insurance, and let's say you get taken by an ambulance and everything, let's say you need an ambulance and you call, you're like, yo, I need someone, that right there could be tens of thousands of dollars as well. Let me know your thoughts in your comments over this way, because that is what the Democratic Party is trying to stop with this whole government shutdown. Thanks, you guys.
My friend who's retired, I believe she's 67 now, just got her Medicare Advantage premium details for next year. And her out-of-pocket maximum expense went from $4,200 a year to over $10,000. So if she has some kind of emergency where she requires hospitalization or emergency room care on a retiree's income, she gets to pay up to $10,200. This is Republican policy. She lives in the state of Indiana. And this is what all the cuts to everything are doing, all the budget cuts to every state. And these are the decisions each state is making individually on what's going to be cut, who's going to have to pay more. And people think that there's going to be an end to this shutdown. You've got Caroline Leavitt lying, Donald Trump lying about all these people not getting paid, all of these layoffs. They don't give a rat's ass about layoffs. If they did, they would have cared about the 280,000 federal workers who lost their job because the guy who runs X and his little 19-year-olds wanted to give so much more money to the billionaire class in tax cuts that they just stuck it to all of us. They didn't care about those 280,000 employees, former employees. And now we're coming up to nearly 1 million Americans laid off because of the tariffs, because of all the funding cuts, because of all the deportations. Almost 1 million employees. They don't care about them. They don't care about them. And to think that Republicans actually believe this administration cares about the government workers being furloughed right now over this shutdown thing. Macro view. Project 2025 wants the Affordable Care Act completely dismantled. They're gutting it. This is on their way to doing that. Once it's gutted, there'll be no more government subsidies for any of us, meaning our tax dollars being pooled collectively and then dispersed to bring down our healthcare costs. No, instead, they're going to privatize everything. So their cronies are going to make a shit ton of money, starting companies that can fill the need or just giving contracts to the companies that already exist, all those MAGA donors. And nothing will be for us. Everything will be out of pocket. We are fucked. So this shutdown is not going to end because Republicans care about people being laid off or because they care about how much we're going to be paying for health care. So there you go. In the meanwhile, look for all your premium hikes next year. And now foreclosures, it was just announced, foreclosures are at an all-time high because people can't afford to live in their homes. It's all coming together swimmingly.
Okay, Big Gretch with the tiny mic. I'm here in Traverse City at Munson. I signed this executive directive today, trying to streamline and help Michiganders access health care. With all the changes that happen in Washington, D.C., I'm really worried about our rural communities. I'm worried about all of our communities, but especially rural communities. And as a provider here, I was hoping maybe you could just give me a little insight into what you see every day and what you're thinking about with all these changes.
Yeah, I think we're really worried too because access to healthcare and being able to go get preventative healthcare is incredibly important. I'm a pediatrician, and it's really important for kids to have those regular well visits so that they can stay healthy and not get sick and need to go to a hospital or an emergency room. And being in a rural area, we already have some challenges. People have to drive long distances. There might be a limited number of providers that they can see. And that's tough for a lot of families to have money for gas and have the time to take away from work to get to that preventative care. If you throw on a whole other barrier of insurance where now I have to do additional steps to qualify or keep my insurance, we're really worried that there are going to be people who are trying their best but just can't do that and then lose their health insurance, and then they can't access the care that they need.
You know, as we think about improving outcomes for people and improving access, is there anything more that we should be working toward as a country or as a state or as a community?
I love the direction that you're going here, which is increasing access to insurance, because if you get a major diagnosis, managing a chronic illness is a full-time job in and of itself, whether it's for you or for a family member. And I've taken care of so many families where there's something serious going on, and just getting to work and just doing the regular things, getting to the grocery store is hard. So anything we can do for those folks to make it easier, that they don't have to worry about health insurance. They don't have to worry about filling out extra forms or making extra phone calls. The health insurance is there. I don't have to think about that. I can concentrate on getting better or getting my family member better. That's what we really need to work on. And really, one of the most important things about this, the change that you're making today, is making sure people still have access to that preventative care, because we just want people not to get to that point in the first place if we can avoid it.
Preventative care, but also the emergent care too, right? I think the way that the folks in this hospital system responded to the incident here in Traverse City, horrific incident, having all this care this close. Who knows if you had a 20-mile drive or a 40-minute drive, what outcomes would be. And that's why having systems like this, you know, have a system where people can get the access is life-saving.
Yeah, it absolutely is. And I think we are the sole hospital in most of our communities. And we're there for our communities. If I need help, if I get into a car accident in Cadillac, Michigan, I'm going to Cadillac Hospital. And so it's really important that we create a system where there's funding that's sustainable for those rural healthcare programs, so that we can make sure we're here the next time something happens.
If you have Obamacare and you don't want it to be 75% more expensive, then you want Democrats to win this government shutdown fight. That's what's on the line. Simple as that. Republicans want to pass a resolution that will make subsidies for Obamacare disappear and in turn make it 75% more expensive for the average person. Democrats don't want that to happen. Which would you prefer?